Hi guys, welcome to another mommy
daughter conversation.
Na hii imekuwa nini, inaingia vizuri?
Niko na base.
Anyway guys, we are back again with another interesting conversation. Of course, when you see us sitting down like this, you know that we have a guest who is not a guest anymore. Actually, we will never refer to her as a guest. Yes. She is a fully fledged member of this family. Officially. Leo ndio tunamuinduct officially. Yeah, so we have our favorite doctor returning for the fourth time. Our favorite doctor in the world, Dr. K.
This will make me cry before I even start. I'm an emotional person.
Oh,
extremely.
That is how much we like
you.
Yeah, emotional people are meaningless.
Yeah. We accept ourselves as we are. That's what makes us unique. Oh, I love you too.
And we love you.
I love
just
you
as you
too.
are.
Thank you.
Thank you so much for coming yet again for another episode. We promised them that we would have we will bring you back for another conversation. And I remember the very first time we met, the very first time we actually hosted you on not these particular ones, but on mother-daughter,
right?
Was this, I mentioned that at some point I would like us to have this conversation because at the time nikitu tu nilikuwa nimesikia fununu, but I didn't know much about it. It's not like I still know a lot. Of course, I've learned some things over time, but it's still very foreign. And I know I am not alone. Najua mimi na my fellow parents tuko hapo. So today, our topic of conversation, Mkamba, what is it? What are we talking about today? I want to see if you do your homework when I tell you. These are the things you're going to talk about.
Our topic is the HPV vaccine.
Yeah, you see? You pay attention. Yes. So our conversation today, and the reason why we have Dr. K back on set, is because we want to talk about the HPV vaccine. And I will tell you the reason for this conversation. So, Dr. K, the very first time I heard about HPV vaccine was when Mumbus was around, I think, 10 years old. And it was a random conversation with some fellow parents, moms. Na ilikuwa tu, actually it's just one person who mentioned, by the way, mesikia hii maneno hii nini wanaita HPV vaccine. Wanasema ati lazima tupatie wasichana wetu. So I was like, huh?
What is that?
Yeah, I was like, what is that? I heard about it and that was it. But I didn't pay much attention to it. The second time I heard about this conversation was when Mumbus was around 12 years old. Actually, that's last year. Is it? Yes.
That sounds so fun.
I know, right? Yeah, it was sometime in last year. Yeah. And actually, sasa iyo, it was another mom telling me, but didn't you know this is the right age? Actually, the question she asked me was, unapeleka Mumbus kupata the HPV vaccine?
Yeah.
I was like, hey, maybe I need to do a bit more research about this vaccine. But from what I had heard from the two parents, and now what I came to learn after my kidogo research, I'm still not a pro at this thing. That's why we have you here. It was a bit different. I was like, oh, okay. Huku anakwambia it's a virus, that nini, all these things. Yeah. But hapo unaambiwa it's a vaccine. Yeah. So I was like, okay. Yeah. So I decided we are going to have that conversation, all of us together. And of course, for the sake of our teenager here, because we want to know kama tumechelewa. Because if I was told at 12 years old, that's when she should get it. But now we are 13, approaching 14 actually. 2 months away from 14. So, Dr. K, Mumbus, have you ever heard of the HPV vaccine?
When you told me to do my homework.
That was the first time. Today we are all going to learn about it. Yeah. So, Dr. K, what is the HPV vaccine? What is it?
Okay. So I'll say the HPV is human papilloma virus.
Yes, that one we have been trying to remember that one. Because we have done our research, so we knew the meaning of the initials.
Yes.
But
what is this now?
What is that?
Yeah. So so this vaccine, we use it against something called that HPV, and it's a virus. HPV, human papilloma virus. It's just like any other virus. The way you have someone has HIV, the way, but it's not HIV. It's just a virus on its own. The way someone can be called Karen, someone can be called Judy, someone can be called this. Yeah. So there's HPV virus. And what this virus does is it likes to attack particular parts of your body. And the one that causes death in women is cervical cancer. It goes to attack the cervix, and then it takes a couple of years before it becomes cervical cancer. Yes. So that virus it goes to those particular cells in the cervix, converts them slowly over years, and then makes them become cervical cancer because it becomes abnormal. Right?
So it's a virus that we have.
No, not everybody has, but as long as you've started having sexual intercourse, you're at risk. It is an STI. It is a sexually transmitted infection.
Oh, really?
It is.
Oh. So what was I reading? I was reading. Yeah, that's why
we make it easier for you, because as you go and read things like oncogenes and all that, those are details.
Like what?
But so it is one of the sexually transmitted infections that can be passed as long as someone has had their first sexual debut beginning. They can easily get HPV. The only thing is that you don't know you have it. You don't know who has it, because it takes years before it converts into something else.
Okay.
And what it does in women is cervical cancer. In men, they might not show anything, but it may affect their throat.
Okay.
Or you can have things like anal or colon cancer because of the same HPV. So it can be passed through sexually transmitted infection, but mainly it's skin to skin.
Okay.
So even a condom will not protect you from HPV. Yes, as long as there's any rubbing.
Yeah.
Okay. So there are types of HPV, that virus, and there are particular ones that cause cervical cancer. Not all of them cause cervical cancer. They're types. They're in numbers, So you'll hear 16, 18. Those are the ones that cause cervical cancer, other than others. But there are others that cause things like warts. They can be vaginal, perianal, so it can be anywhere around where there's skin of either a male or a female. So even a male can present with warts around their private area or even the skin around, because it's passed from skin to skin. As long as there's any rubbing, there is chances that it will just move from one person to another. It looks like like the way you have a mushroom growing on, especially, or let me use cauliflower. You see it, cauliflower, the way it looks like this, So you have like something like that growing on the skin. It can be a small one, it can be a big one. Others, it becomes so big because they didn't go to the hospital. Sometimes you see, those are the things we used to watch when they used to scare us about sexual
the videos.
Yes, those videos. So that's what HPV does. Either causes a cancer or growths. And these growths are not cancers. The ones I've talked about, they're not cancers, but they're caused by other types of HPV.
Okay.
But the main ones that cause HPV is HPV 16 and 18.
Okay.
Those are the most important one that you need to know as we discuss the vaccine. So why we are talking about this is because it is now moving into number one killer of women in Africa. Everywhere in the world, actually, in cancers. So if you have to say women, which cancers kill them is breast cancer, then followed by cervical cancer.
That's true.
Breast cancer is caused by other things. It could be family, genetics, things, environment, toxins, and all those. But you see, cervical cancer is caused by a virus.
Yes.
And how do we prevent this virus? Is either you remain abstinent. Again, abstinence is the 100% of not getting HPV, or you get something that will kill the virus before it forms this cervical cancer,
which is now the vaccine.
This is the vaccine we're talking about. So it is famously called HPV vaccine. Yes.
Oh, okay. That's very interesting.
So
sorry, continue.
So HPV vaccine is given to particular groups of people. Anybody can get HPV vaccine, by the way, both men and women.
Okay.
But who is it going to help? That's the question. So the point is we want to prevent this virus, once it gets into the body, from being active and causing devastating effects on women as they continue to grow. So the best thing is we want to give you the vaccine before you get exposed to it.
Okay.
Yeah, and before exposure, it means before sex.
Yeah.
And that's why now we are talking about giving this vaccine to younger girls. Yes, and this is now where the age comes in.
Okay.
So this vaccine now was introduced actually some time ago. It's been years actually, and it was introduced to this particular age group, which is I'll talk about it because there are different age groups depending on which country we're talking about that get the vaccine. In particular circumstances. So we give it for those ones who have not started having intercourse.
And this is from which?
And we are assuming.
Yes.
We are assuming because we at least we know the debut is equal 16, 18 and above. But now we are trying to get the ones who are younger. And the younger ones are between age 9 to around 12.
Okay.
And that's how the age comes in.
Yeah.
Someone will ask, then if I am 20, can I not get this vaccine if I've never had intercourse? Cindy, yes, you can actually get it. Yes, you can actually get it. The point is we want to give you before you get exposed. That's the whole point of this vaccine. And the best thing is if we can get you between 9 and the age of 9 and 12 for girls.
Yes.
Even boys can get, but why we give 9 to 12 girls is because they are the ones who are going to be affected later on in life if they don't get this vaccine. Boys will not develop cervical cancer because they don't have cervix. Yes, they can develop these other cancers, but the one that is the number one killer is the cervix. That's what we are stopping. That's why we are prioritizing giving the girls rather than the boys.
Okay.
And even giving the boys is not to protect them, is to protect their future wives.
All right.
Yeah, to protect them from this cervical cancer. So that's why we do that. So between 9 and 12 in Kenya, you get this vaccine for free.
Oh.
Yes.
That's why they were very specific about age
9
12.
and 12.
Yeah.
Yeah. So you get it free in Kenya because it's been given in a way that we want to stop this. It's too many cervical cancer. I've seen cases in Kenyatta and it's not good. Not good at all because most people come when it's too late. Yeah. Okay. So between 9 and 12, they are getting it for free. Chapter 12. Unajilipia.
Which is where we are now. Oh.
Unajilipia and it's not cheap.
Yeah.
It's not cheap. Actually, it can go up to 20,000 per dose.
Wow. You mean there are several doses?
Yes.
It's not like a one-off.
No, it's not just
injection?
one.
Is it a tablet?
It is an injection. It's an injection. It's not a tablet. It is an injection. Yeah. So for those ones who are between 9 and 12 years, they get one injection. So there are different types of vaccines before I get into how many times they get injected.
Yeah.
So we used to have, you remember the 16 and 18 I was talking about?
Yeah.
So we have the first vaccine that would just target 16 and 18 only. But it's particularly for 16 and 18.
Yeah.
Then there was another one that was developed that would cover 16 and 18 plus 2 others. Okay, that was another company. And then now the bigger one now, which we have, which is being used, of course, in the US and other places. We still have the 2, we have the 4. Now we have the 9. The 9 covers even for warts. The ones that cause warts.
Yes.
Yeah. So we give now those vaccines at the age of 9 to 12. So the first dose you get now.
Those are 3 doses.
No, those are 3 different types of vaccines. So there's one that covers only for 16 and 18. So when you get this one, you get the same. So they're different. So if you get this first one, you still get it now. After 6 to 12 months, you get the second dose. If you're between 9 and 12.
Yeah.
The same thing, if you get the one with the 4 type, the one that covers 4 types of HPV, I hope it's not complicated. If it gets complicated, tell me. Sometimes I can go on and on and on.
No, I think it's clear now.
It's clear. Yes. There's another one that, you develop vaccine and get better and better and better, yeah? So the other one had 4. It would cover 16, 18. And 2 others. And then now there's the bigger one, which is now the one that is being used. It's it covers for 9 types of HPV. So now that one covers for 16 and 18 plus the ones that don't cause cancer but can cause warts.
Okay.
You get? Okay. So each one of them, if you get whichever, you get 1 dose now. And then the next one you get within 6 to 12 months. Second dose.
62 months.
So, between 6 and
To
12 months.
Okay.
You get the second.
You should know 62
62,
months.
why would you? You just say 3 years or 4 years.
Yeah.
So you get the second dose then. If you're between 9 and 12, okay? But if you get, if you, let's say, it depends on who you are. Maybe your immunity is not very good, because I'll explain why immunity is important in this situation. You might end up getting 3 doses rather than 2 doses, so that it can cover you better. Okay, but if your immunity is okay, you're within that age group, you get only 2 doses.
Okay.
Yeah, maybe if you're now a bit older, before 26 years of age, you can get, depending on what age you get and your immunity, you might get either 2 doses or 3 doses.
Okay.
But if you're above 26, then now we're discussing there's already exposure.
Yeah.
What's the point of this vaccine? So most of the people who are above 26, you just get your review with the gyna and then see what are your benefits of getting the vaccine versus not getting the vaccine. So maybe you engage in risky behavior that might lead you to getting this thing, or your immunity is low and you've been tested and the HPV is negative, then maybe you can also get it. Yeah. Although we don't stop people who want to still get, because we're still looking at the benefits of getting this vaccine even when you're exposed to the virus already. Maybe the cervical cancer will not develop, or maybe it might be not as aggressive as if you never had a vaccine. Yeah. So why I was talking about immunity is because I hope you've gotten the dosaging.
Yes.
Yeah.
Yes,
and who gets it? And then if you missed it at 12, can you get it between 12 and 26? Yes. But it will not be free.
You have to pay for it.
Yeah, you have to pay for it. Why I was talking about immunity is because when the HPV, it's a virus, and your body fights things like bacteria, viruses, and other things. Yeah. When you go to high school, to be protozoa and all those kingdom animalia. I didn't like them. but you will like, I hope you like them. I ended up being a doctor still after biology.
For me, my friend, and many others here. We're here asking ourselves, hizo vitu kwa tunasoma kwa nini? Sindio?
Kingdom plantae. Plantae. Anyway, so your body is able to create an immune response to anything that comes into your body, including even a baby. It will form an immune response if it doesn't recognize that this is supposed to be inside this body. Okay? So whenever you have anything new, whether it's a bacteria or it's an allergen, even an allergic reaction is an immune response to that thing. So it will form an immune response against the virus and include this HPV virus. And that's why it takes years before it forms cervical cancer, because they are fighting there. Who's going to take over? But now you find people who have things like HIV, or immunity is reduced for one reason or another, their bodies will not fight this virus as well as if their immunity was within the normal range. So they develop cervical cancer faster. So it will not take those 10, 15 years to develop cervical cancer. It will form faster. Within even 4 or 5 years, they get the cervical cancer. So that's why it's important to note those people who have low immunity, they might require this HPV vaccine, 3 doses, or even to be followed up better. Yeah.
So this vaccine, is it safe for me?
Okay, that's a very good question. All vaccines have gone through several studies, most of them, except zile zimeharakishwa kidogo. But hata ikiharakishwa, maybe there's an emergency. But this HPV vaccine has been studied for over 30 years. So you have like people who have been followed up since they started getting the vaccine, and whether they've developed any side effects. For all vaccines, there's a side effect. Side effect being pain at the injection site. There might be some swelling, there might be some headache, some vomiting. There are people who are allergic to the contents of any medication at all. So it's important to know that you might get a side effect here or there. Sometimes you get none. But the number of years that it has been studied, it's been safe for our children. And that's why we are able to roll it out as a program, even in primary. I think it's in primary schools where they're taking this vaccine and then giving. But it's important to know that it's you can decide.
Yeah.
It's not a forced vaccine. You have the right to say, I
Yes
need
or
to
no.
study more. I need, it's still important to do your own research, see whether this works for you. Yeah. So, but it's also, you can go through research and see, has it been safe those number of years, because from what we know is that it has been more beneficial than it is those side effects. Yeah.
Oh, okay. That's interesting.
Yeah.
I didn't know that you can get it even past like the 12 years.
Yeah. You
'cause
can
the
actually
conversation
get,
then,
And even there are people who, you see now when you get to 21, 22, and you've already had your first sexual debut, you can actually do some tests to find out whether you do have the HPV or not. Yeah. Or it's important for you to know also, because of your immunity, there are people who can have the HPV, but they don't develop the cervical cancer at all. Because most of the people who are walking around with HPV, but only others will develop the cancer, others will not. Yeah. So it's important to know those ones may not develop. But if you know now that there's a vaccine, it's good now. If you're above 26 years, you can actually go to your, or even above 21, or even below, it's still okay. Visit your gynae, get your personal review,
Yes.
so that they know, is your immunity low? Are you likely to develop this thing? What are the chances of cervical cancer in you than somebody else? And am I a candidate for getting the vaccine? And can I afford, because there's also that. Because it will cost you, where to get it also matters. So it's important to know that in your when you get your personal consultation, and then you can decide whether to get the vaccine or keep following up. Whether it's not a death sentence for those ones who have not gotten the vaccine also. Because some of us, we missed those ages.
Me, I've never ever.
Yeah. So what
Gotten the vaccine,
So what you can do is the follow-up, where we do now pap smear.
Yes, I was actually about to ask that. So that's why we do paps.
Yeah. A pap smear. So I want to, I don't know whether I develop, so I'll explain how our uterus looks, and then a cervix. And I think we talked about it in the last video.
We had some drawings.
Yes, some drawings. Or imagine you have an upside down bottle, where the body of the bottle is the uterus, and then kakifuniko, the cervix.
We have a bottle.
We can see that, Can get a bottle.
Yeah.
Yes. So imagine this is your uterus, and it's usually like this bottle. It's an imagination. And inside, if we want to understand what a uterus is where the baby is carried. It's also called the womb.
Yeah.
And at the bottom of this uterus, there is what is called a cervix. It's like this bottle top. It's the one that opens up, so that a baby can come out. Okay? In fact, it's the one that's most painful during labor. This thing.
The dilation.
Yes, the dilation.
We have not forgotten.
It's not easy, my friend. This opening up is what causes pain, and it's not the cervix. And HPV likes this cervix, and then it develops into cancer. And the cancer can now spread even into the womb. Okay? So now that cancer caused by HPV, we need to find out. It takes a long time for that cancer to develop, but it does develop progressively. Pole, until it becomes something big.
Yeah.
Okay? So inside those cells, it takes years for that to happen. But how do we now detect there's a cancer in this cervix? Yeah. If you already if you've already had sex, there's a chance that HPV has already gotten to this cervix. If your immunity is good, then it might finish this HPV, so it just clears on its own. But if your immunity is just, maybe it's reduced for one reason or another, then it progresses. It overrides the immunity, so it causes the cervical cancer. So how do we check? And that's the question you're asking about the pap smear. Yeah. So a pap smear is a test we do to this cervix.
Yes.
It's like a little brush we use.
We know the brush.
It's a little brush.
Every year.
Yeah.
Me.
Why?
See, to test for cancer.
You have to test for. So you do, it's like a cotton wool, but like a brush, but it's a soft brush.
Yeah.
It goes, and then we scrape off the cells. Yeah, and then it's not painful.
No, it's not painful.
It's not like
Okay.
it's not like Scotch Brite.
No.
Yeah, it's not like Scotch Brite,
Yeah.
but it's just like it's like using a cotton. The way you clean we used to clean our ears with a cotton. So the same thing. You just rub it. It takes cells. Even when you're doing DNA, you do
Yeah.
the same. It's not painful. So you rub it and then take it to the under a microscope, and then we're able to see whether it has started to change.
Yeah.
And it's a good thing if we get it in cellular stage, because it's too small to have spread all over.
Pokwa cellular, you've lost us.
So when we do that, when we're looking under the microscope, we're only seeing cells because that's what we scraped out.
Yeah.
So if we can find the changes in those cells, that's what we call cellular, then we are able to now say, okay, it's microscopic. It's not something visible.
It hasn't spread yet.
Visible. Something visible is like when there's a mass, something growth. Like a growth. You've seen a growth maybe somewhere. Like the way cauliflower, I said a growth like that.
Yeah.
That could indicate that it's cervical cancer. If we see something like that, we don't even need to do a pap smear because we can see it. But the fact that we can't see it means ni kadogo.
Yeah.
We can do something about that kadogo.
Yeah.
Okay. So there are ways to manage it before it spreads into something bigger. Yeah. So that's why we do a pap smear. That's what we call a pap smear.
Yeah.
But there's another test. It's called a HPV virus test. You do the DNA. So the HPV that causes the cervix to change, we also test it. We see whether it's positive or negative. Yeah. So if it is positive, then because there's a chance of getting cancer in that cervix, then we manage that the fact that it's positive, we go and try and remove parts of the cervix that could develop into cancer. I hope that's easier.
Yeah.
So it's
So
not
that's
the
when
end
now
of the
you
road.
determine the different stages of this cancer.
Yes, you're able to check. In fact, for pap smear, because it's not already a full-fledged cancer, it's changes. It's changes that can lead into cancer. So there's cells, you can see the cells are starting to become abnormal, but they have not developed into full-blown cancer.
Yeah.
Then you can be able to say it is in the microscopic stage. If we find a stage that's actually cancerous, like we see this cell is abnormal, but it's confirming that it's cancer, because it can be abnormal, but it's not cancer.
Oh, okay.
Because it's still in the process of changing.
Yes.
So if it's abnormal and it's not cancer, there are some people we say it could be because of infection. We repeat this pap smear after 6 months.
Okay.
Yeah.
Oh.
If it is someone who we find that it is for sure cancer, but
yeah.
it's still in cells, in the cells, then that one we stage it as stage 1. So there are very many different ways of staging it. But the most common, of course, not to go into deeper things, is now that we are able to stage it. But by the time we're staging from stage 2, we are already seeing something on the cervix.
Okay.
Stage 1 is usually microscopic. Yeah.
Oh, wow. So you said it takes a bit of time.
Yeah.
Like years. It can even take years.
Yes.
Like how many years are we talking about?
It depends on the patient and the immunity.
Yeah.
Yeah. So
if my
on
immunity
average,
is
on average around 15 to 20 years.
good. Oh, really?
Yeah. So and that's why we say sexual debut is important, because you start early.
Your chances
You
of
give it
getting it are higher.
you give it enough time
Yeah.
to develop by the time someone is in their 40s. Yeah. So that's why you find a lot of women being diagnosed from 40, 50
onwards.
Yeah, onwards. Unfortunately, we are having people who are in their 30s, 20s because of things like HIV and other things that reduce immunity, so they develop it earlier. Yeah. So that's why we want to, let me give you a picture of why the vaccine is important. We get a lot of patients, and especially in our national hospital here in Kenya, where they did not attend any visits, never knew about HPV, never knew about cervical. In fact, when you tell them they have cervical cancer, they don't even know what the cervix is. And it happens because I learned it in school. Maybe if I was somewhere else, I wouldn't have learned it.
Yeah.
And so we're not blaming them. But unfortunately, because you don't see it, this cervix is inside. If I should draw this way, this, my hands is where the vagina is. You understand?
Yeah.
And this is the outside. Okay? If I should put it this, let me put it this way. This is how the vagina is. It's a space, eh? So the cervix iko huko ndani.
Si kitu hata naona.
Hauoni.
Yeah.
You can't see it. Only when we examine as doctors using
You're
that
able to
speculum.
tell.
Yes, that's when we see the cervix. So you don't feel pain. You don't see anything. You just, maybe you're going to the hospital because by the time it's giving you symptoms, and the symptoms are very bad discharge, foul smelling, maybe blood, or every time you have coitus, you have blood coming out, then those are likelihood that there's a problem with the cervix. Okay, so by the time we're looking through, we find a mass. Or sometimes we're just doing something else, and then or maybe a mother's delivering, and then you find, this does not look normal, because they never felt
anything.
So it's a quiet disease until it gets to the level where it's painful, it is causing swelling, you're having kidney disease, because what happens is that the cervix, when it grows, it continues to grow like a big mass, hapa chini. In front of this, there's a bladder, where your bladder fills up with urine, but the channels that take this urine into the bladder, they pass on the side of the cervix, so they start to block. So you're not passing urine, and now you're having kidney. In fact, some women, when they come with kidney failure, we look for the cervix. That's how bad. You don't know until something else is happening in the body.
That makes a lot of sense, because most of the cases, especially for the cervical cancer, it's by the time somebody's discovering they actually have the disease, it's like it has progressed. Like there's almost
where we cannot be able to remove.
Nothing much that can be done.
So that is why we want to prevent this formation. Because it can happen to anybody. You don't know. You never see it. We lost a very prominent journalist recently through cervical cancer. And because it's very difficult to know, very difficult.
So now I understand the major campaigns around getting pap smears. Okay, that now makes
and
a
now
lot of
because
sense.
we have a better way, vaccinate from the beginning.
Exactly. Now, you're making that appointment right after this conversation moves. What do you think, right? Because anyway, when they say prevention is better than cure, in this particular conversation, it is really important. Prevention is really better than cure. There's probably no cure by the time you're
when it is very aggressive. But again, whoever has cancer right now, because they could be looking and they're wondering, if I knew earlier,
is there something that could have been done?
Anything I would have done before. It's not anyone's fault. The fact that you got it, even if it's through intercourse, it's not your fault, because it's only a natural process.
It's true.
So don't treat yourself to it. What I can say is, if we even get the cancer, then that's why we do what we study for years, so that we can be able to help those people with certain issues. It's not a death sentence as well. That's why pap smear is important. If we find the cancer in the pap smear, just celebrate, because we got it when it's very early. Because we don't do a pap smear when we can see a tumor. We only do it when it's a normal cervix. It's a normal cervix, but the cells showed something else on the microscope, so we can do something about that. If we get a tumor, if it's just within the cervix, we can actually decide, depending on your fertility, what you want. Because again, if we get a tumor on the cervix, we can say to remove the whole thing.
The womb, the entire system.
Because this is part of the womb. Not for you. Not for you. And I get her question, because alafu you won't get children. So it depends on the fertility, your want for fertility. If you want to maintain your fertility, if it's just at the cervix, we are able to remove that part of the cervix. But now it's important. That's why we do surgery. It's to help you, because we are saving your life. There are people who will say, I don't intend to get any children. We remove the whole uterus. But if it has not gone beyond the cervix and affected parts of the, now we are at, maybe it blocks those ureters, the ones that take the urine into the bladder, then that one now we cannot go surgery. because it's already grown. It's gone to other parts. So even if we remove, ishaenda kwingine.
That one is now just managing.
There's some we do radiotherapy. Yeah. Radiotherapy, we use radiation to kill the cells. Yeah. That is it. And some you're able to kill the cells in a way that it reverses.
Okay.
It's still possible. It's still possible. And there are some we still go ahead and do surgery after we've confirmed they didn't get. I mean, we killed all the cells. Or we can reduce the size of the tumor. Okay. Stage 4, stage 3 is the one I was talking about. But now stage 4 is when it has gone to other parts of the body where we use we can either do chemotherapy plus radiotherapy to reduce the cells in the body, but also there are some times when it has gone too far, we might not be able to completely reduce it completely. And we don't want to that's why we don't want to get to that level.
Yeah.
Now we go back to the vaccine. Can we now stop this thing? We do our vaccines.
Wow.
Now you understand why we have to get...
Yes.
Yeah.
Okay. Wow. Okay.
Because I feel like you needed to know the intensity.
Exactly, yes, for us to understand why it is important.
Yeah.
And that was a very good lesson. Very good lesson. Wasichana wenzangu wako hapa na vijana.
Hawajazifanya, mi najua. Ni wengi hawajafanya hata pap smear.
Doli ushaenda pap smear.
See?
Yeah, so this is that
it's only
time.
5 minutes.
Yeah.
And then the test is not, it's just it's doctors will say a little uncomfortable. It's a bit uncomfortable, but not painful.
But it is not that bad.
Yeah, it's not that
because
bad.
I've done it for 2 years now.
Yeah.
My first
not
time
that
was
bad.
last year, but one, and then now last year. And I'm meant actually to go for my another one this year before the year ends.
It's good to
very
do
important.
It's good
and
to
it
do.
doesn't even take that much time.
Yeah.
But honestly, I feel like now is when I have understood the reason why it is so important. So we are doing pap smears, and for our girls, the HPV vaccine.
Yes.
I mean, Mimi, how we do it here, Dr. K, is we all learn together, and then whatever you choose to do with that information, this is for my fellow parents, is up to you. But it's good to know. So me today I've learned, and we are booking that appointment because hata kama tunaenda kulipa
until now.
Yeah, like now, like we book it before Dr. K leaves. Because where it is important, and if you can do it, if your child is under 12 years, please take advantage and do it now because it's free. Before ufikie mahali unaanza kutoa pesa, because our economy does not allow for such expenses. If there's an option of getting it for free, I mean, why spend money? Right? Oh wow. Guys, kama kawaida, I feel like there's nothing else we need to add to that conversation. Kama kawaida, if you have any more questions, please ask in the comment section. Dr. K will help us answer. Mkamba, do you have any questions for Dr. K?
I do not. That was very clear, very straightforward.
Yeah.
And let's go get sindanos.
Yeah, let's go get our vaccine. For real.
Yeah.
Thank you guys. Until next time.
Bye.
Bye. Bye.